ਹੁਣ ਸਾਡੇ ਨਾਲ ਖਾਸ ਗੱਲਬਾਤ ਕਰਨ ਲਈ ਸਾਡੇ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਸ਼ਾਮਲ ਹੋਏ ਨੇ ਸੂਜ਼ੀ ਚੈਂਟ ਤੇ ਦੱਸ ਦਈਏ ਕਿ ਇਹ ਪਾਰਲੀਮੈਂਟਰੀ ਸੈਕਟਰੀ ਨੇ ਫॉर ਸੀਨੀਅਰ ਸਰਵਿਸਿਜ਼ ਐਂਡ ਲੌਂਗ ਟਰਮ ਕੇਅਰ। ਆਓ ਫਿਰ ਉਹਨਾਂ ਦਾ ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਤੇ ਲੌਂਗ ਟਰਮ ਕੇਅਰ ਵਰਕਰਸ ਦੇ ਬਾਰੇ ਗੱਲਬਾਤ ਸੁਣਦੇ ਹਾਂ। ਮਿਸ ਚੈਂਟ, ਵੈਲਕਮ ਟੂ ਸਵਿਫਟ ਰੇਡੀਓ।
Good morning. Thank you so much for inviting me.
Good morning, Susie. And today we're very excited that you were able to join us. So I want to ask you about the new agreement that has been signed with long-term care workers.
So what's happened is it's actually a historical agreement, and it's the next steps in continuing to stabilize our healthcare system, specifically in the long-term care and assisted living sector. In the early 2000s, the then government at the time, the BC Liberals, privatized the care provision in the long-term care area. And with that, what happened was there were many, many workers, over 10,000, who were basically laid off and then rehired at lower wages and reduced benefits. And given that many of these workers were women and were racialized and marginalized women, this had a profound effect on many of our diverse families in British Columbia. Over the years, the Health Employees Union has fought this change, and in 2019, the work was begun to bring the workers back into our health system with fair wages and good benefits, so that they were stable and supportive in our healthcare system. Of course, the impact of that is huge in terms of, especially in our long-term care area, because continuity of care and knowing who your workers are and having them want to be in their jobs and doing a good job because they know they're well supported and valued and respected is huge. So what's happened is it's basically that work is being done now in the long-term care sector to make sure that we are supporting our healthcare workers and supporting our seniors and elders that are in the care environment to have the best care possible from people who want to be there and are doing a grand job.
Ms. Chant, are there any other new incentives or support system to improve staff retention, especially when we talk about senior homes?
Oh, absolutely. And thank you very much for asking that question. What this does is it basically it makes it so that the workers are not only getting good wages, which that came into being during COVID, when we realized there was such a discrepancy in wages among workers in long-term care environments. So the wage leveling happened earlier so that the wages were comparable, but the benefits were not addressed at that time. So now the folks that are working in the environment and providing good care to our seniors and elders are now looking forward to being able to have good pensions and other benefits, such as a reasonable amount of sick time. Mm-hmm. As you can imagine, the job that they do is challenging and needs people to be ready to work and committed to the work that they do. And this will help retain workers within the long-term care sector. What was happening and has been happening is the workers in the long-term care sector have looked at the acute care and community care environments where the wages and benefits were better and have been moving into those sectors. Mm-hmm. Now that will encourage people to remain in long-term care and assisted living.
MLA Chant, one of the key things for our community is because a lot of people who went back to from earning $20, $24 an hour, went back to earning $7, $8 an hour when the privatization occurred in the early 2000s. So now, with them getting back their benefits, I know this will improve retention. What other steps is the government taking to attract and recruit people to work in long-term care, because we know there is an acute shortage?
Absolutely, and thanks, Ginny, for bringing this question forward. One of the main things that was started actually during COVID and is showing great progress is what we call the HCAP program, which is the Home Care Assistance Program, where people were encouraged to come into the home care assistance role, getting training through the system and getting coming in. We've had over 6,000 people go through that program, and that the difference that it's made in the long-term care environment has been remarkable. That program still is in place and is still bringing people in. So that's made great strides. And again, the capacity for not only good wages but also good benefits. The woman that spoke to us yesterday was speaking about not only did she go from a $23 an hour job down to a $15 an hour job, but she also lost her pension and lost her benefits. She had 5 days of sick leave versus quite a bit more when as needed. And now this will address those gaps.
Mm-hmm. MLA Chant, when we talk about long-term care workers, so there are lots of concern about their mental health, about their work-life balance, about their workplace safety. So how is the ministry addressing those issues and concerns?
Well, one of the first things, and thank you so much for focusing on that, because that's critically important. People who work in a care environment need also to be cared for. This is terribly important. And by bringing folks back into an environment where they are supported and valued and respected, that does an awful lot for helping with mental health. But there are also other supports that are part of the benefits package, such things as EFAP and that kind of thing. And the other thing is that with this, we're also looking at people taking a position that works for them and that keeps them in one area. For instance, at one point in COVID, we realized that people were working 3 different jobs to try and make enough to support themselves and their families. And now what has happened is with good earnings at one job, whether it's part-time or full-time, that allows people to not have to do those 3, many different jobs in order to earn a good living. And also with that gives them time to be with their families, which is, we all know, is very important. Thank you.
Well, thank you, Emily Chant, and we thank you for taking some time out and then talking about long-term care workers. Thank you.
Thank you.
Thank you also for taking this, recognizing the seriousness of these folks and the importance of their job in keeping them safe and valued and respected, the workers themselves. And what that does is it provides higher quality care for our seniors and elders, which we all want. Thank you so much. Bye-bye.